Good morning. Brandon, is that you from the health department?
That is me.
Hi, I'm Jill. Just wanted you to know I'm going to introduce that you are on. I wasn't necessarily going to have you speak unless you want to say something. To start, just wanted people to be aware that you're there for any questions or concerns they may have.
That's fine by me.
Okay.
Whatever you need, I'm here.
Thank you. And thank you for the short notice getting on here.
No problem. That's kind of what my role has been since this all started, is just be where I need to be. So
I think all of our roles have changed since this all started. Yeah. So thank you.
Is my background visible?
Yes.
Okay. Sometimes I have issues with that room behind me because it gets too bright during like midday, but right now I think it's okay.
Yeah, I can see you clearly. Nice.
Perfect. All right. Well, I'm going to go back on
room.
Yeah, it's not a bad sunroom. It's one of the reasons why I wanted this house. It's pretty nice. So, I'm gonna go back on mute until you need something. I'll still have my volume on. So,
sure.
Just let me know.
No problem. Thank you. Brandon, I just want you to know I'll be right back. I apparently did not log in as host, so I've got to re-log in as host.
Okay, no problem.
Address, you will receive a copy of the recording and of the chat box questions as they come in those answers. So if you did not register, please go back to our website. Even once this is over, you can still register for it, provide your email address, and you will receive that information.
Okay, it is 5 minutes after, so in the interest of everyone's time, we'd like to go ahead and get started. Please remember to keep yourself on mute to cut down on the background noise. But then also remember, if you are speaking or have a question, to take yourself off mute. Welcome everyone to the Toledo Regional Chamber of Commerce Northwest Ohio Business Reboot Initiative Roundtable on Childcare. My name is Wendy Grams, the President and CEO of the Chamber. And on behalf of our Board of Trustees and our over 2,300 members, want to welcome you to this morning's session. As I said before, we haven't figured out a great way to allow for networking, which is sometimes the best part of these gatherings, and certainly haven't figured out a way to serve you all coffee like we normally do. So hopefully you've made your own arrangements. And Mark, that's my joke for the morning, so you'll have to take it from there. Wanted to introduce some special guests, which Mark, you already did in one case, but I believe we have State Senator Teresa Fetter with us. Senator Fetter, are you on the call? Welcome. We also have State Senator Haraz Ganbari, who is also on the call. I can actually see you. Thank you. Welcome. Welcome. Thanks for being here. And then I should also mention that we do have some members of the media on the call, so just wanted to welcome them as well. And what I would like to do is just talk briefly about the Reboot program and show you some of the resources that are available. And then I will turn it over to Jill Badger, who will introduce a few people, one of whom is going to make some opening remarks, and then the others will be available to answer your questions. And I know there were some questions that were posed to us when you registered, so we'll do those first. And then if people want to start adding some other questions in the chat room, I will do my best to monitor those and get those all answered. We are planning for just an hour, so we'll try to stick to that. If you do need to leave the meeting before that, we certainly understand. As Jill and Julie mentioned, we will be recording the session, and you will be able to go to the website and listen to it again if need be. Want to welcome you all. I think if there was ever a doubt in anyone's mind about how important childcare is to our economy, that question should be answered. As we try to reopen our economy, it certainly was very evident that we would not be able to really do that successfully until such time that daycares were open. I think it's easy for people to think about their own situations, and if they don't have children yet or their children are grown, they really don't realize that the parents in our workforce, children can't go to school, daycares aren't open, very hard for them to go back to work. And it's probably very hard for them to work at home as well. My children are grown, so it was much easier for me to work from home, but I remember days when it would have been much more difficult. So hats off to the parents that have been doing that for the last 2 months. Wanted to take you through our Reboot initiative. We put the Reboot initiative together, and we didn't just want to do that as the chamber organization, but we wanted to pull in a lot of partners. Some of them are on the line with us today, and I'll mention them in a second, but really wanted to talk about what we're doing. We put together a lot of resources. So I am going to share my screen here and take you through our website. Okay, if someone can nod, let me know you can see that. Okay, great. So we very quickly changed our website over to almost exclusively our Reboot initiative. And again, that really started out with providing up-to-the-minute information on orders that were coming from the governor, up-to-date information on what was happening with the SBA in regards to the EDL and the PPP and other resources that were available for businesses. I'm getting a little audio feedback. Is everyone hearing me okay? Okay, great.
If you're not on mute, again, can you please make sure you are on mute so we're not getting the audio feedback, please? Thank you.
Thank you, Jill. So again, we put together some information. We've been working very closely with the health department that is also on the call and will be introduced in a moment, so that you had up-to-date information on closings, on the stay-at-home order. We did provided a lot of information. There were a lot of questions on essential, non-essential businesses. So we provided information on that, and really just started to compile all of that information in one place. I know that you all are probably getting hit with a lot of emails and expert information. We've really tried to compile all of that into one place so that you have one resource that you could go to. So I wanted to show you that. A lot of resources here. You can sign up for some email updates. So if you're not currently a chamber member, feel free to sign on to that, and you will get special information regarding the reopening now. If you click on the Reboot Initiative, you can very easily reach our staff. You can connect with the SBDC. Our Small Business Development Center is the program that is really how we have what we've really built the Reboot Initiative around. Many of you have probably worked with Jill Badger and other people from the SBDC as maybe you were starting your business. We do a lot of startup, but we also do a lot of work with existing businesses. We did a lot of turnaround work in 2008 as part of the recession. We worked very intensely with about 100 existing businesses from all different sectors of the economy. We do work a lot with daycares from a startup and an existing perspective. Jill Badger, we call her our resident expert on daycares. And so there's a lot of information on this site, but if you need some one-on-one assistance or you want to talk confidentially about your particular situation, whether it's of a financial nature or workforce or anything going on in your business, if you're thinking about expanding, looking to really calculate your break-even point and how you might be able to save on expenses, we have knowledgeable, certified staff, certified through the state of Ohio and the U.S. Small Business Administration, that can help you answer those questions. It's confidential, it's free of charge, and you do not need to be a member of the chamber to do that. One of our other partners, our Minority Business Assistance Center that's located at the University of Toledo. We've already heard a little bit from Mark Urrutia. They pretty much do the same thing. So I would encourage you to contact the SBDC or the MBAC if you want to have some specific consultation about your business specifically. You'll also see the health department guide and the business reboot checklist here on the left-hand side. Everything that you need to know from the health department is there. We've also put together a business checklist. So things that you need to think about, not necessarily related specifically to COVID or specifically to social distancing or PPE, but things that you should be thinking about in terms of your vendor relationships, your workforce, a lot of those sort of general business principles. You'll find a checklist there of things that you'll want to be thinking about. We also put together on the left-hand side here, you'll see our business reboot policy recommendations. We are a lobbying organization, and we really focused our public policy agenda on issues that would be that could be helpful to people as they reopen. So things like, deferring property tax payments. We worked pretty closely on, making sure that we could defer liquor licenses for restaurants. So some of them are broad-based for all businesses, and some of them are very specific to specific businesses or industries within our region. So take a look at that. If there are things that you think we haven't thought about that would be helpful specifically as it comes to public policy for the daycare industry, please give us a shout out and let us know about that. You'll see here on the bottom all of our partners. The Regional Growth Partnership, the Toledo-Lucas County Port Authority. I believe we have someone from the Port Authority with us today. Connect Toledo, Destination Toledo, the City of Toledo, Lucas County, the Toledo-Lucas County Public Library, BGSU, Lourdes, Owens Community College. I believe there's someone from Owens with us. University of Toledo, we have folks from that organization with us. The Employers Association has a representative on the line. LISC Toledo, Toledo Community Foundation, I believe there's someone on the line from that organization, the United Way, Jumpstart, Ohio Small Business Development Centers, the Minority Business Assistance Center, SIFT, and the Ohio Manufacturing Extension Partnership. So a lot of people working together to make sure that you have the information and resources that you need as you restart your business. I'd be happy to answer any questions about that initiative. If not, I will go ahead and I will turn it over. I think I've covered everything that I was supposed to, at least initially. Turn it over to Jill Badger, who is one of our certified business analysts with our Small Business Development Center at the Chamber. She's going to introduce some of our expert guests and panelists. Jill?
Good morning, everyone. Today we have Michelle Bieber, who will be speaking to us. She is an owner-operator of Over the Rainbow Early Learning Center in Toledo, Pennsylvania, and she was a representative on the best practice
call the front desk. Melanie, front desk.
Advisory Council. We also have Brandon Polinsky from Toledo Lucas County Health Department, Serena Rayford from the Lucas County Job and Family Services, Kirsty Monolin from Northwest Ohio YWCA Childcare Resource and Referral Association, Libby Schoen from United Way of Greater Toledo, and Camille Harris, owner-operator of All for Kids, who is an SBC Advisory Board member. A few others I'm sure that have joined us will be able to answer any questions as you guys have them. So please put those in the chat box as you have questions. Michelle?
Good morning. Thank you for joining today. I truly appreciate everybody's time. One of the things that I will tell you on the Open Gate, I am involved in many organizations, the Ohio Association of Child Care Providers, Child Care Advisory Council, and many committees that follow along with that. One of the things today I want to stress very clearly, today I am speaking to you just as an owner-provider. Sometimes being involved in so many organizations, when I say the word we, I have in my head the conversation of who the we is, and I forget to mention who the we is. So in regards to that, just know today I am speaking in regards to me being an owner and to that extent. I am privy to all the information due to the organizations that I am involved with. So it does lend me to be able to speak to some of these things. So today there is a lot of questions around reopening, how, what, when, where, why, and is this something that we should be doing? So at any point in time, please interrupt me. I've been given the gift of gab. I can ramble, and so if you don't interrupt, as I'm told, you can't get a word in edgewise. So please don't feel that you're being rude. So one of the pieces that I'm going to start off with by saying is I'm going to give you a picture of what my center looked like pre-pandemic, just so you can have an idea. And I'm going to move a little bit towards what my center is looking like today to give you the opportunities. And then we're going to move into you as owner operators or anybody out there in regards to what it is that childcare looks like today. Keep in mind, not every center, not every childcare facility, type A, type B, doesn't fit in the same box. But one of the things that I have found out, speaking to 9 legislators over this time, that our numbers, no matter how big or how small, they do represent the childcare industry by all means. So prior to pandemic, I have 2 facilities, 3-star rated. I had 230 children enrolled in my facility. My demographic was 12% funded, including children through child care services, as well as protective services. Along with that, generally, just so people have an idea, the EBITDA in regards to childcare is very low. It can range anywhere from 8% to 12%. There is just a wide range. Again, childcare doesn't necessarily fit in the same box. Currently, on a monthly basis, I've been losing $21,000 a month. In regards to that, as of May 31st, I will have lost $47,000 in regards to closure. I employ 35 staff members with 2- and 4-year degrees. I have a competitive salary. Teachers are doing professional development annually in regards to first aid, CPR, communicable disease, along with the additional 10 hours of professional development. In regards to that, I pay over $1 million in annual wages. My taxes that I pay is about $168,000 in benefits and workers' compensation and payroll taxes.
Michelle, you muted yourself.
Actually, we're still getting background noise, so I hit mute all. So Michelle, just go ahead and take yourself off mute.
Okay.
That'll be best
Sorry
way to
about
work
that.
it. There you go. Thanks.
So in regards to children and families, the reason why we do what we do every day, day in and day out, not just because of the profit by all means, it is the hugs at the end of the day. So in regards to that, we are an educational facility providing appropriate activities. We learn through play. We counsel with families in regards to best practices in regards to child's health and well-being. One of the things that did concern me during closure is we provide $85,000 annually in regards to nutritional meals. What that does total up on a weekly basis is 2,730 meals of breakfast, lunch, and snack. So what it is that we do is imperative, and it's extremely important to our community for the children and families. If I were to remain closed, I continue to lose $21,000 a month. I have 100% unemployment, and I have displacement of 230 children and families. So in regards to that, that is, a hefty thing to think about. So one of the pieces opening today, which I am a center that is reopening June 1st, one of the pieces with that, I am certainly following Responsible Restart Ohio with childcare and the things set forth with Governor DeWine. So I am absolutely grateful that we moved into this direction and very pleased, as well as the families. So much gratitude goes to our opening date. With that, obviously, we are going to follow the new compliance rules and best practices, but this only gives me, with these new guidelines, the ability to service 55 to about 65% of my existing children and families. Again, keep in mind, I had 230 children enrolled prior to the pandemic, and with these new guidelines, unfortunately, I will only be able to serve 127 children. That is substantial. So I asked myself, where did those 103 children go? I am required, or I need to have 90% of my employment back. I will instate full medical benefits, but due to the substantial increase of staff and staff hours, one of the pieces that is so important that we do have to meet best practices and these new guidelines, which increases our staff hours. What is happening with these ratios? I am still at a loss of $16,000 a month. So if you can think for the next 3 months, that will be $48,000. That is substantial. This is still a risk to my business, a substantial loss, but it is providing the opportunity for childcare to open, and with hopes of that these restrictions will begin to change. So with that being said, what I'd like to do is move forward and ask the question, is opening right for you? So there are some things with this that you need to look at, and some of the questions that you need to ask. What is going to be your attendance in your building? How many classrooms do you have? What's your building capacity in regards to these new guidelines? When you look at your revenue stream, you need to evaluate in regards to how many children you have in your building, your staff coming back, and relate that to, is this a good decision for you? Because one of those things that you really need to think about is are you having more of a loss being open or closed, or what is it worth to you? So there are definitely things that you need to think about in regards to, I know it is exciting for everybody and getting that June 1st date, but as a business person, you need to look at those things and understand if it is appropriate for you to open. So again, in regards to those costs, looking at the ratios at your staff and what your startup costs are. So in regards to some of these startup costs, you have to think, I need to order food, I need to order PPE, I need to have masks, I need cleaning supplies. Again, we have a rule set in place in regards to the standards given that we have to have 6-foot barriers. So with all these things, you need to think about as well, cost versus time versus worth. So when you are purchasing these products, that you really need to think about as well. So is the $2,000 portable sink worth you buying in regards to your classroom setup? Okay, so there are definitely things. What type of wall barrier are you getting in regards to your building? You know, are you buying plexiglass? Are you buying dividers? What is the cost to that? So there are, again, things that you need to think about. So when it comes to the PPE and the masks and things like that, so in regards to best practices, there are things that that it has been stated that it is not necessarily required. But one of the things that you need to adhere to is what is best practices. In the line of things, it is important for the health and safety of everybody involved. And we always want our industry to fly and soar and look great, just like every other business. So it's important that we utilize the best practices that have been given to us. So it's important that we think about how we are utilizing our PPE materials and how we are looking in the classroom, that we are not forsaking the quality of learning for the children in the classroom. As always, in the childcare industry, we have to make our rules balance with what we do in the classroom. So there are some questions in regards to staff coming back. Again, with staff coming back, that there are a lot of questions that I had with my staff coming back. So I am trying to evaluate the staff that I have in my building that have children, that have health conditions. And as I'm opening my center, I may not necessarily need some of my staff because I'm only bringing 90% back. So I evaluate the 10% and say, okay, who are these people? And can I help them stay healthy and be at home, still being productive with what they're doing before I bring them back? So there are some parts in there that you need to look at in regards to who is in your building. You may have staff that say, well, I don't want to come back. Well, at that point in time, if you're asking them to come back and they're not meeting whatever health requirements or what have you, that is your business decision and your right to decide what to do with that staff member. There are things that work around that unemployment portion. So I think it's really important that you evaluate the situation of what that staff member is telling you and what it is that you want to do for your business practices. So moving forward in regards to training and onboarding, it is imperative that you think about these things before you open in regards to your training and onboarding. So you want to give your opportunities to your staff in regards to how you are doing your procedures. So one of the things that I am doing is that I am having a training day to go over all the processes and procedures in regards to best practices, meeting all the new guidelines from Governor DeWine and what we are doing in our building in regards to best practices, because they need to know what to do in their classroom and how their classroom is going to function on a daily basis. Every building has different nuances. Again, childcare does not fit in one square or one box. So you need to evaluate your building, your facility, and how that best functions with you. There have been workarounds in regards to people getting children out of the car. There have been things in regards to families coming in regards to just the foyer. So you need to really think through every process that you're doing. So one of the pieces, if you are putting children in cars, you need to make sure you tell those parents that the child is in their car seat or if they are not. So there are some pieces with this that you have to truly think through every single process that you're doing. And again, and it's not just for the staff in regards to onboarding. You have to inform your parents and communicate with your parents in regards to what is it going to look like in regards to processes of the families coming into your building and what they are required to do and what your expectations are. So that is another piece that is really important. Absolutely.
We're getting a lot of questions in the chat box, so I wanted to start addressing some of those. Are the new ratios only in place for 3 months? Does anyone on the call know the answer to this?
There is no timeline on this. For as much as everybody is looking to put a timeline, I have my hopes and dreams of what this timeline is. But one of the pieces that I will tell you in regards to these ratios, we will not be able to function past 2 to 3 months with these type of ratios, as well as I believe come September, the demand is going to be far greater than what it is today.
Okay,
So
but
this
at this time, we don't have clarity from the governor's office. Right now, this is, these current ratios that we've been given are what there is for moving forward.
Yes.
Yeah, Jill, I would add too that, and I think we need to make sure that we get to some of our other folks that are on the call that can discuss this. But I think as long as we have a couple members of our state legislature on the phone, I think it's important to, and we will continue to reach out to all of you and with some surveys. I think it's really important that, I know you're going to be busy, but if you take some time to provide us feedback, we will make sure that we get that collective feedback to our governor's office and our elected officials, because I think the financial scenario that Michelle outlined is probably very similar for a lot of you. There's also a lot of questions about, with these ratio changes, will there be, will we be able to meet demand? I think demand and the financial implications on the daycares really need to be balanced, obviously with the safety, the reason this is happening in the first place, because you're right, it's not sustainable for businesses, and people cannot get back to work if they don't have childcare. Early childhood education. Someone informed me right off the bat that I shouldn't call it daycare, and I apologize. I understand that's an industry nuance that I'm not part of, so I'm not aware of that. And so I get it. It truly is early childhood education. I know that from past experience, so apologize for that. But again, perhaps we can move on to just a quick call out to the county health department. They can talk a little bit about some of the PPE information. We want to make sure that, Michelle brings up a good point, that's a cost, but are people finding access to that? We do have some providers on our website as well, some local providers. And then talk a little bit from the health department perspective, rather, about enforcement. So Jill, if you'd like to go and introduce our other guests.
So Brandon, are you still on from the health department? Is there anything you would like to discuss regarding PPE or job and family services? If Serena is still on, if you would like to discuss anything regarding the PPE or the grant applications for people, the $60 million that from the CARES Act that will be dispersed. I know there's a lot of questions around that and how the application process will go. OCRA is managing the $60 million, the Ohio Child Care Resource and Referral Association. The application and process has not been published. I know they're hoping to make that published by May 31st, but I do not have any insight as to what that application process looks like yet.
No, hi, this is Serena from JFS.
Thank you.
We do not know what that grant application looks like either. The coordinator was on a call on yesterday, and he was not given any type of information, and they said that something should be out before May 31st regarding that. What was your other question?
Any comments around like PPE or best practices, or I guess people are asking, we don't have a timeline yet for how long these ratios will be in place, correct?
That's correct.
So whether it's the next 30 days or 3 months, we have no timeline. And I know
we don't.
Michelle?
So there is an outline. If you go to ODJFS website, there is a pandemic toolkit. It is helpful in regards to kind of some of the planning pieces in regards to what your center looks like. The best practices, there is a 77-page slide. Well, when I had my hands on it, it was a 77-page slide. I don't know what it looks like today. It needed to go through some edits yet. So that should be dropped soon in regards to all of best practices. And this is through 8 entities, everybody from the WHO organization to CDC to APP. So it's just a lot of entities, as well as there is on that pandemic toolkit in regards to, they call a transitional pandemic. There is also the 2-page Responsible Restart Ohio on there. So if you can go to the ODJFS website, Childcare, and click over to pandemic, and it's on the right side of the website. it will give you an amplitude of information.
Serena, it's my understanding people are asking about rates, that the pandemic pay ends. You will be paid from the week of May 24th through May 30th. And as of May 31st, pandemic pay ends. So on the 31st, your reimbursement rates will look like they did prior to the pandemic. As far as if you were a 3-star, you will be reimbursed at a 3-star rating. There won't be any more 5-star pay during this lower ratio time, correct?
That the payment rates are the same as the pre-pandemic payment rates.
Okay.
So yes, things will go back to the way they were prior.
And can you clarify a little bit around the pandemic days allowed and the absentee days? Like there are 20 absentee days. Is it per JFS calendar year? So does that end like June 30th, where their days will reset in July?
Yes, exactly.
Okay. So
Exactly.
absentee days of 20 days reset in July, and pandemic days that you're allowed are only allowed if a center has to close due to a suspected case of COVID, correct?
That's correct.
Okay. And
Can I speak a little bit to the 60 million?
sure.
So in regards to that $60 million, it may seem like a substantial amount of money, but if you divide that through the 7,000 childcare centers in the state of Ohio, that leaves $8,571. So in regards to that, it does seem substantial in regards to spreading it out across the state of Ohio. And I know they are working on a plan, but that is not substantial money at all.
Serena, the pay reverts back to attendance. So when somebody asks, how will parents' authorized process be? That's back to the TAP system, correct?
That is correct. Once, starting June 1st, or June 6th, is it? When everybody goes back, when childcare opens back up, the TAP system will be the method of payment at that point.
Okay. Brandon and Kevin Carr from the health department, if either one of you would like to say anything.
Absolutely, Jill. Thank you. I just wanted to let everyone else say their piece because you are all involved in childcare. I do not have children myself, so we are here to address the health side. And I see one question of we need more guidance with the complete list of rules and regulations that we're going to be required to enforce. You can find the absolute mandates through the governor's Responsible Restart Ohio under the childcare fact sheet for that business sector. Really for childcare, it looks like the main requirements are behavioral or process modification versus PPE. So staff who can wear masks, you are going to want them to wear masks. That's not that feasible for children. So that's not in the recommendation, or at least not in the requirement. It might be recommended under best practices. But really it's going to come down to hand washing, distancing, and keeping those minimum ratios at all times. Not letting parents into the facility if you can arrange that. Curbside pickup is best. And really to limiting those symptomatic individuals from coming into your facility. So setting up some kind of reporting measure with parents. Is your child sick? Please don't bring them in today if they're sick. And I did notice something that was key for the general guidance. If someone presents with a fever, an adult, right now we typically say they need to go 3 days fever-free without medication before they could return to work. In the childcare guidance, it's only 24 hours for children. So that is a very big difference. So if a child does come to the facility with a fever, they do not need to be excluded from the early learning education, as I learned from Wendy. They do not need to be excluded from that facility for more than a day, as long as that fever does not persist. They need to be fever-free for 24 hours without medication versus the 3 days for adults. So that is definitely a change. I can also say that yesterday at the governor's press conference, he announced a new urgent health advisory to replace the Stay Safe Ohio stay-at-home order. That has not been released yet, at least in document form. He did talk about it yesterday. some of the restrictions and some of the mandatory requirements remain in place, but others have been lifted or modified with that order. So we are waiting at the health department to see specifically what they're going to put into that besides what he talked about. But it sounds like if you looked at the business sector guidance, it's available on Responsible Restart Ohio and through the health department's guide for reopening Lucas County Open for Business, which we'll be updating as soon as the governor drops that new requirement. That should help you figure out what exactly you need to implement at your business versus what is just a best practice recommendation that you'll probably still want to consider, but it's not necessarily a mandatory thing you must put in place. Also in regard to that, Wendy or Jill, I think, mentioned what the enforcement process will look like. So the health department, each local jurisdiction has been tasked with enforcement for all the different business sectors. Right now, what that looks like is we have a call line. You could also use the contact us, and this is more for individuals who feel that the facility may not be meeting those minimum mandatory standards. That call line number is 419-213-4161. But the health department doesn't want to just come in and say, we got a complaint, you have to shut down. We're here to work with you. If we do get a complaint, we're going to call, we're going to say, hey, this is what was said, what's going on. We're not even necessarily going to come out and visit your facility just for a single complaint, but we're going to talk through it and just kind of see what can we do to make sure that it's as safe as possible for everyone, because children can carry the virus just the same as adults can. Not everybody has symptoms, so we really want to limit that spread so that we don't face anything like we have over the last couple months. So we'll have that conversation. If we get repeated complaints, then we might stop out and say, okay, we really need to talk about what's going on. Is it just a parent who is going above and beyond, and maybe they don't understand what's required, and they think it should be X when really you just need to do Y? So we'll talk through that. We'll work through that. And we're really not looking at this with a heavy hammer. We're looking at this as a partnership to help you function and also to keep everyone safe from a public health perspective. Okay, I think my
Thank
gift
you,
of gab has expired for that segment. So if we have specific questions, please feel free.
Serena, I have two for you. Somebody wanted to confirm that everyone's parent authorizations for TAP have been extended by 6 months. So
That's correct.
okay,
Yeah.
so if they should have expired during this pandemic, it's been extended 6 months, so nobody has to worry about that. And
That is
then the other question was, can a center use pandemic days if they're not ready to open on May 31st, or do they have to open first?
Not after May 31st, they cannot use their pandemic days, no. And the fiscal year begins July 1st.
Okay,
So you had asked me that previously.
that's
But
okay.
yeah, they cannot use their pandemic days.
And Ms. Camille, you had a question regarding dividers.
Yes, thank you. Actually, I have a couple of questions, but for the dividers, in the information that ODJFS sent out, it was saying that we needed to contact the fire department and the building regulations. So in my center, All for Kids, I have a couple classrooms that I'm going to have to split down the middle. But if I want to open up June 1st, especially with building regulations and the fire department, we're not going to have enough time to get all of that in place to get these dividers approved. So is there, I don't know, somebody that out there that can help us figure that out?
Could I ask a question to piggyback on that? Are
Sure.
you saying the fire department needs to verify your space, or what exactly was that requirement you're referring to?
Yeah, to verify, to make sure that it's not right compliant or health code. I mean fire code regulations.
Okay, because if you're speaking about the general guidance that the governor put out of only allow 50% of your maximum fire code present in your facility, I just want to make sure you're not referring to that, because the fire department doesn't actually determine that.
No, this was sent out by ODJFS last night.
Perfect. I will go back on mute.
Okay.
So it's important to consult. Camille, it's really important to consult with the fire department and
Most
the
definitely.
building code in regards to your egresses and making sure if you have sprinkler systems that it's meeting those qualifications. So it's not that it's mandated they have to do an approval. It's a matter of consultation, calling on the phone. First, start there and say, you know, this is what I have going on. Do you have anybody available to come out and see? And be very clear and communicate appropriately. It's in regards to if you have a lot of questions that you feel that you're not meeting or that you feel uneasy about it, then that's absolutely make an appointment. Start with a phone call first and tell them what you're doing and how you're doing things and have that conversation with them. And then evaluate the importance of them coming out in regards to making sure that you're meeting every requirement that you need to in regards to building code and fire.
Thank you,
I don't
Michelle.
know.
I already have done. But I'm saying if we're giving the okay to start back up June 1st, I'm going to have to get it delayed because, of course, out here in Holland, they want to come out to make sure. So the phone call has already been made. But for me to be on the right track, what I'm saying is we want to open up June 1st, but because of this, it's going to push back my start date. So all the phone calls have been made. All the measurements have been taken, but I'm just saying this is another hurdle that we have to get over in order to reboot the economy or start back.
In the city of Toledo, we don't even have that many fire inspectors who are even able to come out and visit how many centers we have.
Exactly.
We
Exactly.
truly have a fire marshal that you call, and you're going to need 2 weeks before you get an inspection. Furthermore, just to come out to make sure that I'm using the correct dividers in the correct positions. We don't have the amount of fire marshals available that document is requesting for us to even call. If you've ever called the fire marshal before to get him to come out and do a visit, that's going to be a few weeks. And it could happen in a week. So let's be honest. Sometimes they can get out in a week if they're on your side of town, but they're shorthanded themselves. There's only about 4 fire marshals who handle the entire city.
Is there an opportunity?
We will reach out. There's a number of advocacy issues that we need to really speak collectively on, and I think you all are absolutely right. You know, there's going to be a bottleneck if you truly have to get some confirmation from the fire department, whether it's City of Toledo, Holland, whatever. We can try to reach out to those jurisdictions and at least make sure that they're ready and that they're doing everything that they can to expedite that. I don't believe we have anyone from the city on the call, but we will definitely take that back to the city and the county as to one of the many barriers I think that are stacking up in my mind. You all are making the opening of restaurants seem really easy compared to what all of you are dealing with. So that's truly coming through loud and clear, and we're already talking about some things that we can do statewide with some of our other partners to make sure that the decision makers understand, you know, that some of what they've put in place, it just is not going to allow you all to continue to operate on a long-term basis. You know, less clients, more restrictions. These things are you know, not making sense.
I believe Becky Collins has her hand raised. If you
Yes.
still have a question, please unmute yourself and ask.
Yes, I'm a family childcare provider, and I had a question about the sinks. I asked my county job and family, and they didn't have any idea what I was talking about. So does that pertain to us being in a house? How does that work for us?
In regards to the portable sinks?
Yes, like the new sink rules.
So they are allowable for childcare centers. My suggestion would be to call your specialist in regards to if that is allowable in the type A and type B.
Well, I guess who is my specialist? Because like I said, I called county and she didn't have any idea about a sink rule. And do I need it is more what I was asking. I'm only allowed 6 kids.
You know, the sync thing was not a rule. It was just a suggestion, because in the center you will be breaking up your space to where normally all of our infants were near a sink. We're now breaking our space to create 3 separate infant spaces, and the
Okay.
traffic we would have to go to the sink would be too much traffic, or the distance from where you would throw away a poopy diaper to the sink may be
Right.
too much now, because we're not using that diaper changing area for that whole entire room. We've now broken it up. So they've given us a suggestion of adding in a portable sink, so we didn't have to travel that far with soiled hands.
Okay. All right. I was just confused about that, as far as, how that worked in a, family childcare section, but really I'm not breaking apart anything because I only have 6 at a time anyway. So,
Hi, a lot of people have asked questions around PPE. The chamber has a part of our website on the reboot has resources for our members, and PPE is listed on there, but at this time we also have Kevin Carr, who's from Silverback, on, and he has PPE available. So if anyone has specific questions on how you can get it or what they have available that you need prior to opening, he can take questions on that. I know some providers were saying trying to get thermometers before opening day was not proving viable. So if you have any questions regarding that, please check out our website or ask Kevin directly.
I will say too, that's, also a problem with opening the daycare, childcare last, is that, the candle store I went to has a thermometer, but now there aren't enough for the child care centers. So that's, again, unintended consequence, but I think also posed a problem that as you're sort of the last to reopen, a lot of those supplies are now in short supply again.
Is Serena still on the call? Because I have a question for JFS. I know that pre-pandemic we were traditionally faxing over authorizations and daycare applications, but will they be going back to full staffing when this June 1st takes place? So will we go back to just faxing over applications for childcare or any services that the parents need, or is there an email that we should be using now?
Who am I speaking with, please?
Alexia from 3 Hearts.
Oh, hi. Yes, everything goes back to normal. We have always been full staffed. It's just that we are currently working from home. We do have some people in the building, but we have less than 100 people currently working in the agency. So things are still moving in the agency as normal. It's just that the applications and things like that are being routed to our workers that are currently working from home.
Thank you.
You're welcome.
Do we have any other direct questions from JFS or the health department or about PPE? It says, somebody asked, can we talk a little bit more about the screening process and what we should have for our families? Worried about what children are bringing to the schools, not what's happening in the school. So are there requirements? Do you test every child before they enter? Are they required to be tested at home? How do you ensure testing is done before the children are entering your facility?
Can I speak to that a little bit?
Sure.
So in regards to that, there are policies that you need to work around. Again, there is a 2-page policy. First, we're waiting for the emergency rules to drop, which they have not done yet by Governor DeWine. So we're waiting on those. There is a 2-pager on the ODJFS website in regards to responsible restart. And it does give mandatory as well as recommended. So some of the things and policies that we have to work on: drop off and pick up policy, what your sick policy is for staff and families, what your emergency plan is in regards to communicable disease, your meals, your cleaning, your classroom equipment, keeping things child specific, and then health screens. So one of the things that is required is that Anybody who is entering your building is to be mandated that they get their temperature taken. How you choose to do that is up to you, whether you do curbside service or you have people stop off at the foyer of your building. So one of the processes that we are doing, we are not doing curbside service, but we're only allowing one family at a time in our foyer area as a check-in place. That we have a runner as well as a temperature taker. Okay, so with that being said, we are full PPE and the parents are required to wear masks as they enter our building. We are taking everybody's temperature in regards to where they're at. You have to be careful in regards to logging that because there are HIPAA laws that are around that. There have been some centers across the state of Ohio that have been getting in trouble in regards to that. So take heed. So in regards to that, that is kind of, you have to work on those processes in regards to what is suitable and how that fits your facility, because the opportunity to do curbside service does not fit every center. Coming into a foyer does not fit every center, but the health screen of what you are required to do has to be done prior to coming into the building or at an established place before you're allowing people to move through the building or what it is that you're choosing to do. I am not allowing that to happen. We are taking the children and bringing them to the classroom.
Someone said all 50 students arrive at the same time. So that's something you're going to have to consider on how you stagger that, whether you have families wait in vehicles and accept one family at a time, whether you change your drop-off time for a certain number of children, but something will have to be addressed because obviously you, as you said in the chat box, you cannot take 50 kids' temperatures all at the same time.
The piece about children bringing things to school, again, we're talking best practices here, and it's how you're storing and how you're keeping children's personal belongings. One of the pieces that we have to understand, we have to continue to make our facilities a safe, quality center for children. So if they are bringing blankets to be comfortable while they're taking nap, please, let's continue some of these comfort pieces for the children. We cannot have just the unintentional consequences. We still have to do our job. So we need to think through these processes in regards to, so is it that we take everything out of the bag, we place it immediately when we take the child and we put it in the cubby? I am separating every child's cubby. I have the opportunity that their things are not touching other children's things. How we're stacking cubby, our cots, we are removing the blankets and they're going back into their cubby as we stack cots, and they're being sanitized before they go on them again. So, I mean, we have to think of every aspect of what every child is doing and where they're going and how they're touching things.
As a pandemic center who's been operating since we were in our previous lovely state, we've been blessed to have a vestibule. So you're right, each center does have to come up with their procedures based upon what their location looked like. We've been blessed to not have any COVID exposures or suspect cases either. Conversation with your staff is the most important part before you get all this started. You can put all these things in place, but if your staff are not a part of the planning, it will all fail. So just have a conversation with your staff and letting them understand and be aware of what's the requirements from the state and what you're going to do, because the state doesn't require me to wipe down touchable surfaces every 2 hours, but I do. The state doesn't require me to make sure that that parent doesn't come in my daycare and I temp outside of the daycare. We do have a documentation, like she was talking about the HIPAA laws. We document the same family, same page, so that for one, you can pay attention, because some people may have a normal temperature where they're always at 98 degrees all the time. So if I can look at your record of your temperatures you've been having at daycare, I can see the spike before the spike kind of happens, because I'm documenting all of your temperatures for this family on the same page. So it allows you to keep track of temperatures better. We do hand washing every hour. We stop whatever we're doing and we're going to do hand washing. And we make sure that when we are picking up the kids from the door, we are with our masks on. Something new that we'll add in June 1st will be requiring the parents to now wear a mask also. But most of my parents, when the children are school agers, they don't even want to step into the building. They would honestly prefer to stand on the outside of the building just because they are aware of what's going on in this world and understanding that we are trying to limit as many contacts from outside world and coming into the daycare. But I tell everybody on all these calls is communication with your staff. If you don't communicate with them, that's where your ball of frustration is going to start, getting them on the same page as you.
Can I speak
Thank
a little
you.
to the masks? In regards to the mask, please remember children 2 and under, they are to not wear them. Any child that has difficulty taking on and off, please take heed. When you are taking temperatures, if you are wearing that mask, please know if you're, depending on the thermometer that you're using or your device to take that temperature, you need to pay attention. If a child is rolling out of bed and they've made it there within the half hour or 20 minutes, because a child is in a relaxed state, their temperature is going to be elevated. If you are wearing a mask, you are having hot air blow up, your temperature is going to be higher. Okay, and that's coming straight from a doctor's office. So when you are taking temperatures, please pay attention when we have our mask on, that it does heat up our face. And so just there are things that we need to do good practice and use our common sense when we are doing things, especially caring for children. I truly understand that, you know, we have to be extremely vigilant, extremely. Health and safety is number one. But when we are dealing with children, one of the pieces and the best practices that we need to isolate a child that is said when a child is fussy, when they have a runny nose, when they are coughing, when they have a rash. This is what child has on a daily basis. So some of the pieces that, again, we deal in childhood common illnesses on a daily basis. So if a child is teething, they're going to have a runny nose and they may run a temperature. Imperative, isolate the child, remove them. Let's figure out what's going on with the child and then move forward.
Serena, someone asked how a new family applies at this time. Sorry to catch you off guard.
That's okay. They would apply the same way they would. They can go online and get an application there. We do have applications currently at JFS. We have a stand outside that is filled every day with childcare applications, and they can fax it or email it to the information that I put in the chat.
Thank you. And there has also been information added to the chat regarding PPE. Camille, you had another question?
I didn't have a question. I just had, I just want to say that as providers, we need to be a community. I mean, that me being a provider, I should be able to call another provider. I mean, every time we get on these chats, it's a wealth of information, and it seems like it's such limited amount of time to try to get our questions and concerns in. But I just wanted to reach out to the community of providers to let everybody know that if there's a question or a concern, or if you just want to rant, we should be able to call up another provider and say, hey, what do you think about this? What do you think about that? So I'm offering myself like, hey, I'm here to support. We are all in this together. Everybody's center is different. Everybody's viewpoint is different. So I know I'm a little bit overwhelmed with all of this, but I just feel that we need to come together to be on one accord to provide quality early childhood education for all of our families and our children. So, you know, if you need to talk to me or anything, I'm here. I hope I can call Alexia or Linda or everybody, and we can just kind of get through this together instead of being just so overwhelmed, because a lot of our questions aren't getting answered, you know. So I just think we need to come together as a community of providers to help one another through this time. Thank you.
Camille, I'd like to talk about that for just a second. I know that we have, you know, we have the Ohio Child Care Advisory Council, we have Job and Family Services and some other groups. If there isn't somewhere else that these are organized on a regular basis, we are happy to do that for this industry. We could have these calls once a week and maybe they end up being 30 minutes a few weeks down the road, but we are happy to put this together on a regular basis. I don't want to duplicate what's already being done out there, even if you could provide us some feedback, maybe on the chat or a quick call or even now, we're happy to do this on a regular basis, if that's something that would be helpful, because there certainly is a lot of information being shared. And we have our lobbyists that are quietly taking notes on this, and we're going to be reaching out, as I said before, to other business organizations across the state to say, look, we've got a potential problem here, and the child cares in Columbus and Dayton are having the same struggles that you all are. How can we kind of pull everybody together and perhaps get some policy changes, or at least make sure that those that are making these rules really understand, what they're asking you all to do. So happy for feedback on that.
I have one more question. Maybe Serena can answer. Somebody is asking, does a type A childcare program need to have separate rooms in order to be allowed to have their 12 ratio? Are they still allowed to have 12 children in a type A?
The new ratios came out, and I'm not sure what they are, to be honest, but I don't think that they can.
What about anyone from the YWCA? Heather?
I was going to say, Jill, based on the survey that JFS sent out to the providers, one of the questions they asked family child care providers was to provide the total number of children that they expect to serve when the child care can reopen. For a type A provider, no more than 6 total infants, toddlers, preschool, and school age, with no more than 3 under the age of 2. If the type A provider only serves preschool, school age, then a maximum ratio of 1 to 9 children.
Thank you very much, Heather.
They won't be allowed to have their 12 based on that.
I don't think anything is clear. That's what we all been having a discussion about, is that it's not really clear on that 1 to 9 or 1 to 12, because depending upon how your house is laid out, it's easy for people to have 9 in one space and 3 in another space. Honestly, in the city of Toledo, there's not too many type A's who were originally given the square footage to have enough room for 12 kids anyway. A lot of them have their license for the 11 kids. So the square footage of your home and what you originally licensed for is what will even determine that maximum amount. We've been going back and forth with licensing specialists right now, because that part doesn't really make sense. If I have a home that has 4 different rooms in it and I use my whole floor for the daycare, why wouldn't I be able to have 9 in this room and 3 in another room?
Right. I understand what you're saying, Lexi. I'm just reading what went off the survey that JFS sent out. Based on that, it tells me that, at least right now, they're saying no more than 9, because, again, the governor's trying to keep group size to a 1 to 10. No more than 10 people in a group right now. So they're trying to keep that, small. That's just what I'm going off of.
So somebody asked, is the ratio same group size 1 to 9 for preschool or school age, or 2 to 18? It's 1 to 9 per classroom. So school agers, where you used to have 1 adult to 18 children, that was in 1 classroom. If you want the same 18 school agers, you would need 2 separate classrooms and divide it 1 to 9. Yes. Am I correct?
Yes,
Yes,
correct
that's
statement.
correct. That's correct. When I talk to state, those 9 children is 35 square feet per child, which
Correct.
will have you with a 10 by 20 room. So as long as you measure that room to have the 35 square feet per child for those 9 kids, you will be great. Make sure your partitions still allow the correct square footage is the only thing that the licensing specialists are emphasizing on when it comes to that accommodation, because everybody's used to 1 to 18. So right there requires you a divider.
Thank you very much for your help on that.
Jill, I did notice too that there is a weekly call of the Toledo Directors Network Tuesdays at 1 p.m. So perhaps we can make sure, Jill, you and maybe someone from our advocacy team can participate in those, just to make sure that we're hearing, what your questions and concerns are, so that, like I said, we can take that to our statewide groups as well. And again, I think it's really important. We're able to speak not only on behalf of you as businesses, but on behalf of, folks like the Andersons that are on the call, that are very concerned about, they can't get their workforce back and productive and their businesses going if there aren't enough early childhood education facilities See, I'm learning, you know, for their employees. So, you know, we're not only speaking on your behalf, but on behalf of businesses all over the state. You know, if this doesn't work out and you all aren't able to sustain these numbers and there's not enough centers to meet demand, then opening, you know, our economy and our businesses is not going to be successful. So there's a two-prong approach, if you will, to the lobbying efforts that need to take place.
Wendy, can I speak to that a moment? So one of the pieces that I'd like to talk to is prior to the pandemic, we had approximately 280,000 children across the state of Ohio receiving childcare. As of post-pandemic, children and centers being open, we will only be serving 112,000 children across the state of Ohio. So it is a twofold problem. It is a catch-22. Where are all those other children going? So, and what is that doing for workforce? What is that doing in regards to, because employment facilities or businesses cannot employ people because they are trying to keep their costs down, or they can't get the people to come in and work, that hence they're being furloughed, or that there is some type of not ramification, but that the other businesses are having to adjust to meet the need of their employee because they cannot get childcare.
And how many centers have surveyed their parents to see, are you guys going to be at capacity for the new ratios? Because when the chamber did its research, only 24% of the parents we surveyed said that they would be comfortable sending their children back day one. I mean, obviously our hope is that as you guys open and as the economy reopens, that number drastically increases. But have you surveyed your parents to see how many children are returning to your centers so that you personally know what those ratios look like and that you can afford to reopen your center? If anyone needs help figuring out their budget or their break even, I do that on a regular basis, specifically for childcare. There are several providers on this call that can attest to that. I can help you try to figure out if the new ratios will allow you to pay your bills and break even and what that looks like and how you move forward.
So yeah, and I think some of those numbers are kind of coming in. People are letting us know. I think, you know, the other thing that you're going to probably see happen, the same reason why you may have difficulties getting your workforce back is the same reason that, you know, workers may not be coming back and may not need your services. I think time will tell, you know, end of July, if that $600 a week goes away, a lot more people will be entering the workforce. And that survey that was done by an independent group, it didn't survey parents, it surveyed people. So a lot of them probably didn't have children. And it really talked about their comfort level in going out and doing things more so than it was speaking to, again, workers, you know, with children. So, but that is something that you will have to monitor. And again, at least you can start with the clients that you have. Hey, are you coming back and when? You should get a pretty good handle on that. You know, again, versus a restaurant or retail that's like, doesn't really know, well, how many people are going to really, you know, come back to my establishment when I open. So that might be the only place you have a little advantage to some of those other businesses, is you know who your customers are, at least who they were, and you can survey them to find out, you know, what their plans are. But I think that end of July, August 1st, there's going to be, I think it won't be coincidental that you'll probably see a lot of people returning in August when they indeed decide that they have to go back to work.
But this will pose a problem. This is going to be a problem.
Yep,
because
absolutely.
If that needle doesn't move in regards to the restrictions, we will not be able to do anything. And so
right.
When that July time comes, this is where your businesses need to come to you, and as well that we need to start advocating change. Grant you, again, keeping health and safety, it gives us the opportunity to see what things look like in the next couple of months. But a lot of people are anticipating, they put a timeline and they want to start back up in August.
Mm-hmm.
But if that needle doesn't move, there is nothing we can do.
I have a question that has appeared a couple of times. Someone is asking if they serve both infants and toddlers, how do they do the 1 to 9? My assumption based on ratios is you can't. It would be a 2 to 8 because ratios for infants are 1 to 4. So
Infants
you would
and toddlers is 1 to 6.
It's 1 to 6.
Infants and toddlers 1 to 6.
Okay, thank you. So you cannot have a room of 9 children that are combined of infants and toddlers with 1 teacher. So that answers
And if
that
it's a
question.
home, you're not having that many either. That's
Okay.
what, at least
Honestly,
that's
you
what we're
would
saying. Or they're
honestly, you
saying.
would do, your infants are 2 to 6, and you can do 1 to 6 with your toddler group.
Okay,
So
thank you
just
very
to-
much for that.
Yes, to go over ratios, it's 1 to 4 for infants or 2 to 6 for infants, 1 to 6 for toddlers, and 1 to 9, each in their own classroom.
Make sure you remember those 35 square feet.
So I think we've tried to answer as many of these questions as we can. If you would like to email us and with more questions, we will do our best to get answers out to you as we work with providers and legislature moving forward. This chat and the recording will be sent to you if you've provided us your email address. But thank you everyone who has been on this call today. It has been great chatting with all of you, and I hope at least a portion of all of your questions have been answered here today.
Yeah, and I would
Thank
echo
you.
Jill's comments. Good luck to all of you. I mean that sincerely. Please reach out. It's in the community's best interest that you all figure out a way to open successfully in a way that, you know, is financially viable for your businesses long term. If there's anything that we can do to help, please do not hesitate to reach out. Again, you're such an important part of our economy. And we need to work to make sure that you can continue to provide services to our workforce. So thank you all for what you do every day, and all of the things that we've talked about, all the challenges you have, doesn't even bring into you know, consideration of the work that you actually do when you get the children into your facility to teach them and care for them, which is also so important. So thank you all very much.
For the providers on, don't hesitate to reach out to the YW. That's what we're here for, the Child Care Resource and Referral. We're staying on top of things the best we can. So if you're not sure how to get a hold of us, we've got someone in the office pretty much every day that can. The rest of us are working from home, but they can get a hold of us and we can, you know, get back with you. So please don't hesitate to reach out.
Thank you, Heather.
In regards to advocating, make sure you get with OACCP, the Ohio Association of Child Care Providers.
Camille, did you have anything?
Yeah, I just wanted to say good luck to everybody. Like I said, I'm out here if you need help, if you need me. But let's also remember too, this is not post-pandemic. Post means end of. This is during the pandemic. Nothing that we're going back to June 1st is going back to our regular lives. It's not going back to the post. It's not going back to our old ratios and having our own kids. This is during. We're opening up still during the pandemic. So the word post is not accurate for me because we're still in the act of or in the act of doing.
Mm-hmm.
So let's be safe. You know, let's be knowledgeable. Let's read everything that comes through. Unfortunately, JFS rules are not ready. So we're still grasping. Every time an email comes in, we're grasping to try to get the knowledge. I really wish everything would have been set in place when the governor said, hey, you're allowed to open. But since it's not, any information that we get, we should share it with one another. I know I try to do that a lot with my provider friends. So, you know, good luck to everybody opening up. Thanks. Have a good day.
Thank you, everyone.
I'll post my phone number for you guys. Y'all can call me whenever. And I'll come up to your site and take a look if you want to come up, brainstorm together. Because I
Thank you.
definitely believe that 2 minds is better than 1. And
Agreed.
if it could
Absolutely.
be, if it could be 3, that would be great too. Brainstorming through the process, y'all. I'll tell you.
I will do this weekly. If you guys want a provider Zoom, I would be happy to facilitate that weekly to just let you guys get on and all talk and just share as providers what you're going through, especially as this moves forward.
Jill, you and I can talk because I think that's something the YW is going to try to implement.
Awesome.
Seeing it's a need. So
Great.
you and I can talk and we'll figure something out.
Thank you, Heather.
All
I've
right.
been a part of a lot of Zoom calls, y'all. So The more, the better.
I don't know about you guys, but I miss the YWCA Summit that is usually in April, because that's when we get all the providers in one room and really get a lot of conversation going on best practices and what you guys experience, and definitely missing that. So if Heather and the YWCA can put something together, hearing what you guys go through daily will help not only yourselves, but those of us trying to advocate for you. So thank you all very much.
Thank you.
Great, thank you, everyone.
Bye.
Thank you for your help and participation.